Well, again tonight, we are taking your questions, but we want to start with something a little bit different. It's a passionate and sobering wake-up call from an emergency room physician here in Toronto. Now, earlier on the National, we heard Dr. Jennifer Tomlin call for more Ontario businesses to shut down. And now, for the record, she explains why Canadians must heed the call to stay home.
Because there is community spread now. We know this for a fact. You have to assume that every single person you come into contact with is positive. Like, you just have to, because we are not testing people. We can't test people. So the numbers that are being reported every morning, every night, that is falsely reassuring to everybody. Those aren't the number of cases that we have in our province or in our country. There is a ton more. We just don't know it. We are about 3 weeks behind Italy. Life is not going on there. In fact, thousands of people are dying. So life is going to go on, hopefully, but not in the way that we're used to. And we actually have to get our heads around that and subscribe to it. It is our duty, it is our job to protect our population. We don't have the tests. I think the public is now realizing that. Our numbers have dropped off a bit, but now it's the calm before the storm, and the storm is coming. All the sick people that have COVID-19 are going to start to come in, and they are going to tax our healthcare system tremendously, because the people that just have regular heart attacks and strokes and appendicitis and all the other normal emergencies, they're going to still come in too. We have to conserve resources. We can't have everybody getting COVID-19 at the same time.
So with me again tonight and listening in on what we just heard, Dr. Alison McGeer, an infectious disease specialist with Mount Sinai Hospital in Toronto, and Dr. Lenora Saxinger, an infectious disease specialist at the University of Alberta. And as I said, you were both listening to that. What did the two of you think?
I think I'm a little bit more hopeful than Jen that we might be bending the curve and that we're not about to see an explosion. But I don't know that, and I would echo her plea. I think you've probably heard it from everybody now, if you've been on the news, that we need people to be physically distancing themselves from other people. We need everybody to be doing everything they can to slow the curve of this virus. If a week from now my hopes are right and we're doing a little better, then we can talk again. But at the moment, every single one of us just needs to be doubling down on not doing the things we don't need to do, not coming into contact with people we don't have to come into contact with.
And I would actually support that very much. I think that any unnecessary contact right now could result in, honestly, based on the literature, thousands to tens of thousand cases later if someone is actively able to spread virus. And so the precautionary principle is you want to do all the right things up front. And so I think what I heard from that Emerge doc is very much what I'm hearing from my colleagues here as well. And people have to take this absolutely seriously.
Well, if people do take it seriously, then this next question that we've got may be one that more and more people will ask. So here we go. How safe are deliveries of any kind? So we're talking packages, but also food. Dr. McGeer.
Again, you know, the issue is people, not things, okay? You're in more danger getting close to the delivery person than you are accepting the package from the delivery person, because it's fresh droplets from people that are the problem, and maintaining physical distance from people is more important than worrying about fomites. Having said that, you know, get delivery in, take it out of its container, clean your hands, and then you're fine.
All right. Dr. Saxinger, here's the next question for you. A lot of people wondering where the light at the end of the tunnel is. Should I just assume school is canceled for the rest of the school year?
Honestly, I think that people should make that assumption and plan accordingly. If things normalize more quickly than we expect, that would be lovely, but I think that it might be not highly likely. So I think people should plan for the long haul with the current situation.
All right. Dr. McGeer, which is safer, public transit or taking a taxi or an Uber?
Well, that's a really interesting question. And it depends a little bit on how long your trip is, and who else is on the subway and in the Uber. If you have the misfortune to get into an Uber with somebody who is infected but doesn't have symptoms, then you might get more exposure to them. If you get on the subway, obviously you're likely to come into closer contact with more people. So averaged out, taking an Uber is probably safer, but once again, we come down to don't take trips you don't have to.
Okay, Dr. Saxinger, here's another question. Can you be infected through an open wound, like a cut in your hand?
No. Well, essentially, no. I guess we should never say never, but really this is a virus that's spread through respiratory droplets. So contact by inhaling, by oral, nose, and eye exposure to contaminated hands would be the main mode of acquisition, and there would be no suggestion that skin-to-skin contact of any kind would be a risk.
Okay, we've got time for one more question. Dr. McGeer, is cash safe to handle right now? And I know you talked about fomites just a few moments ago.
Well, if you clean your hands after touching it, absolutely. But I totally get the fact that everybody's worried about everything, and I'm sympathetic to it. And so, if you live in Sweden, Sweden's a cashless society. And so I do think that in the interests of just the anxiety of everybody who's working in our essential stores, our pharmacies, our grocery stores that need to be open, I think it's a kindness to them if we all start using, credit and debit cards.
Dr. McGeer, Dr. Saxinger, thanks so much for both of your time.
You're welcome.